Hello, everyone, and a warm welcome to another episode of the Talkroom series of podcasts. I'm Wendy, and today we're diving into the incredibly interesting and important subject of online therapy. We will be looking at this and how you can be your best self, even when faced with this particular challenge, by leveraging the power of counselling and therapeutic support. For those who are joining us for the very first time, I would like the opportunity to introduce my co-presenter, Ian. Ian is a senior accredited National Counselling and Psychotherapy Society member and the founder of Hope Therapy and Counselling Services. Hope is a counselling and coaching organisation offering support throughout the entire UK for a very wide range of concerns and challenges, and works with this kind of area online and face to face on a very regular basis. A warm welcome to you, Ian.
Thank you, Wendy. Thank you. And let me return the favor by introducing you. Wendy is a highly experienced CBT psychotherapist that has been involved in the field of mental health and general well-being now for 35 years. We're both incredibly passionate about helping people just to navigate their mental health, their relationship, and their general well-being journeys. And today's discussion about online therapy is a really important part of that.
Totally agree with that, Ian. Absolutely. And I'm just wondering, maybe you could start by just saying a little bit more about what online counselling or therapy is.
Yep, absolutely, of course. Online therapy, sometimes called virtual therapy or sometimes called remote therapy, is simply counseling delivered via some form of secure video call, and that could be something Zoom or FaceTime. Those are examples that people may have heard of. But it can also be done via phone call or even live chat in some instances, rather than in person at a physical location. And it's a very common way of working here at Hope. About 85% of our clients nowadays opt for that way of working. So it isn't regarded as a fringe way of working or a rare way of working these days. It really is incredibly common. And therapists around the country offer individual, couples, family counselling and therapy, as well as very specific and more specialist approaches like CBT or EMDR or hypnotherapy. And they will do that all through various different online platforms. And the advantage is that clients can access sessions from anywhere in the country, sometimes even internationally, providing that they have a private space and an internet connection. They can work with someone who specializes in a particular approach, which may not be available in their own areas. And the goal is to make support more accessible so you can fit it into your life more easily, especially if travel or mobility or busy schedules make traditional in-person sessions a little bit trickier for you. And clients experience exactly the same confidentiality, exactly the same professionalism and support as they would face to face. It's just done in a way that's often more convenient and more comfortable for people.
Very interesting, Ian. Very interesting. And to me, that makes a lot of sense. And the actual process of online therapy sounds really flexible. I'm just wondering if there's any particular types of clients or issues that tend to work especially well with online counselling, or is it suitable for most people?
Yeah, a really great question, Wendy. So thank you. And for most clients, online therapy works incredibly well. And for many clients, it's definitely their preferred way of working. As I said earlier, about 85% of people that come to Hope opt for that way of working, especially for those with busy work schedules or maybe caring responsibilities, or anyone who might live in a remote area where face-to-face options are limited, or maybe someone is just looking for a particular person or a particular way of working or a particular specialism that isn't offered just down the road from where they live. We often find it very supportive for neurodiverse clients or members of the LGBTQIA plus community who may prefer the comfort of connecting from their own space with someone who has specific experience in those areas. And maybe that specialism isn't offered locally. The particular person that they'd like to work with just isn't local to them.
Okay, thank you. That's really great, Ian. Thank you for that. Um, I'm just wondering if you could perhaps share a little bit more about why counsellors tend to offer both online and also face-to-face counselling, and why online support is so important right now.
Yeah, absolutely. And again, a really great question, Wendy. So, if I speak for us, if I speak for Hope Therapy and Counselling Services, philosophically, we believe that everyone deserves access to quality support, no matter where they live or what their personal circumstances look like or what their particular needs are. And if we think back a few years to when the pandemic hit, online therapy became almost a necessity for so many people. But even as restrictions have eased, we've seen that the benefits of online support remain really significant for people. And just having the option for online sessions means that our clients don't need to worry about factors like travel, like mobility, or even finding time in that really busy work schedule that so many people have these days. It allows people from all walks of life, including those in remote areas, those who are neurodiverse, or anyone who simply feels more comfortable in their own environments. Often people with anxiety may struggle with the idea of going out, getting in a car, traveling to somewhere that they've never been to. And to access therapy in a way that just takes that stress off and makes it work for them a little bit easier. For us, it's all about meeting people where they are and making sure that support is accessible, safe, and as flexible as it possibly can be.
Yes, totally agree with that, Ian. Some great points there. So thank you for that. It's really good to hear how online therapy can widen access to therapy as well. But I'm just wondering whether some people might worry that it feels maybe less personal than a face-to-face session. So I'm just wondering how therapists maintain that sense of connection and trust when working online.
Yeah, and I think that's a really valid concern, a really important concern. And it's something the counselling and therapy profession more generally has thought an awful lot about. And while it's true that being in the same room can sometimes help people feel connected to the person that they're with, we found that really strong therapeutic relationships can absolutely be built online too. And all of our therapists and most therapists these days are trained not just in different therapeutic techniques like general counselling or CBT or EMDR, but also in how to create a supportive, a warm, and a confidential environment through video or phone sessions. So this is something that people have gained an awful lot of experience at doing. And if you consider organizations like the Samaritans, for example, in 2023, they answered over 3 million requests for help, and the overwhelming number were not face to face. So the non face to face support model is a very well established model in this country and has been actually for many years now. I think a big part of things is just making sure that sessions are client centered. So we go at the client's pace and we prioritize what they need to feel safe, to feel heard. We also encourage clients to find a private, a comfortable space for their sessions wherever possible as well. Really working with the unique needs of the clients that we're working with. And what we often find is people actually find it much, much easier to open up when they're at home without the pressure of a new environment. And as I said earlier, without the stress of having to get in a car to drive somewhere, worrying about whether they're going to get there on time. And ultimately, it comes down to trust and it comes down to genuine care. And those things can absolutely shine through, whether we're face to face or we're speaking to someone via the phone or via a screen.
Okay, yeah, absolutely. Very good points that you've made, Ian. That's really interesting. I'm just wondering, my next question is to perhaps give us a bit more context. Could you maybe talk us through how online therapy has become so prominent, especially since the pandemic, which has been it's been great for therapy generally. Can you tell me a bit more about that?
Yeah, absolutely. And as I mentioned earlier, the non-face-to-face model has existed in this country for many years, pre-COVID, long before COVID came along. But the shift towards online therapy really accelerated in the therapeutic and counselling world during the COVID-19 pandemic. And people throughout the country, throughout the world, found themselves in situations where leaving home wasn't possible, it wasn't safe. And so finding new ways to access support became a really essential thing to do. And organisations like Hope and many others were very quick to adapt by offering all of the same services that were adopted previously and offered previously. And that would include one-to-one work, couples work, family counselling, and as I say, maybe some slightly more specialist things like CBT or EMDR or hypnotherapy. They're all able to be offered nowadays using online platforms. And what's interesting is that even as life has settled back into what we describe as the new normal. Most clients that work with us, at least, have chosen to continue with those online sessions for all the reasons I gave earlier. So it's not just about necessity anymore. It's about accessibility, it's about flexibility. And people appreciate, I think, being able to attend sessions from the comfort of their own home, whether they're in a busy city or in a rural village somewhere. And for some clients, online support removes some of the practical and some of the emotional barriers to seeking help as well, making therapy just feel a little bit safer, a little bit more accessible than maybe it would have done previously.
Mm. Yeah, it's a really good point, Ian. Another really good point. And it's good to remind ourselves that this is a really positive change in terms of accessibility for individuals, people who can't attend therapy because they haven't got the transport or they're agoraphobic. There's all kinds of reasons why people, even social anxiety, might be hard to attend therapy.
Absolutely.
So there's
Absolutely.
lots and lots of people I can think who really benefit from the online therapy. And now there is such a diverse range of people now engaging with therapy online. I'm just wondering if you notice any shifts in the kinds of topics or challenges that clients bring to sessions. Is there any difference there, do you think?
Yeah, a really great observation, really great question. The move to online therapy has just allowed us to reach a much broader range of people and a much broader range of circumstances. What we're seeing more clients who may not have sought therapy before. And as you said just now, Wendy, that might have been due to anxiety. It might have been due to anxiety around traveling or agoraphobia or social anxieties. Might have been concerns about privacy or simply a lack of local options. So, in terms of topics, there's definitely an increase in conversations about loneliness. We're definitely seeing that's more prevalent. Adjusting to hybrid working patterns is something that we often find ourselves, and this ties into the loneliness, is definitely something that we find ourselves talking about. Changing in family dynamics and the ongoing stress many people feel as the world tries to rebalance post the pandemic. But really, what it's shown is that pretty much nothing is off the table in terms of what people may ask for support with. So every single presentation that somebody might previously have spoken to us about, we talk to people about now in an online capacity as well as a face-to-face capacity. We've also noticed a greater focus on things like self-discovery, actually, and personal development. And people have taken the opportunity to reflect on their values and relationships during this time of change. And no matter what someone wants to work on, our approach is always the same. It's always client-centered, it's always confidential, it's always professional, it's always ethical. And that doesn't change whether we're working in an online space or whether we're working in a face-to-face space.
Yeah, absolutely. And that's really important. Those boundaries are maintained and those
Absolutely.
ethics and values are maintained, and people know that as well. Absolutely. So let's talk specifically more about the positives. So, from your experience at Hope Therapy, Ian, what are the main benefits that online therapy brings for clients, as well as the accessibility we've already spoken about?
Yeah, actually, there's quite a few. One of the biggest benefits is the accessibility side of it that you mentioned. Clients from all over the country, sometimes internationally. So whether they're in busy cities or rural areas, can now access support without the barriers of travel. And that's especially meaningful for people with maybe limited mobility, those with busy work lives or family commitments, or just people living in areas with fewer local mental health resources. But another benefit is the flexibility aspect to it. Online counseling just allows clients to fit sessions into their lives more easily. And that can really help people stick with therapy as well. And it can just help to build the momentum of therapy. And many clients mention that being in a familiar environment like their own home helps them to feel a little safer, helps them to feel a little
Mm.
bit more comfortable, which can just make opening up easier. So that being able to pick a counselor to work with who can be really flexible in terms of what they offer, when they offer it, but also having the comfort of your own things around you as well. It, our experiences, we often find that people actually maintain the therapeutic process, whereas maybe previously they may have dropped out on occasions. We've also found that more neurodiverse members of the LGBTQIA plus community have reached out to us as well. We often hear them say that online settings can just help the anxiety aspects of things. And just practically speaking, there's also the convenience of just not dealing with traffic, not just having to worry about public transport or having to carve out that extra travel time that can be so hard for people to do in a busy world. And therapy can just genuinely be part of your life rather than becoming the extra added stressor that you have to fit in.
Mm. Absolutely. And when you're visiting an office, you've got that travel and sometimes the stress of the travel because you don't know what the traffic's going to be like. Is it going to be
Absolutely.
busy or
Absolutely.
not busy? And so you can, if you get stuck in traffic, you can feel quite stressed even before you come to the session as well. Absolutely. I really understand that. Yeah. And I find it really interesting to hear how online therapy can remove barriers for so many people. That's really good news, isn't it? That's very good. And I'm wondering if you've got any examples of clients or therapists have noticed any unique positives since moving online, maybe building even more engagement or connection.
Yeah, absolutely. And a lot of our clients have found that online sessions allow them to share more openly, actually. Sometimes even more than they might in a personal one-to-one setting or more quickly. And for some people, there's just something about being in their own space, maybe sitting in your favorite chair, having your pet nearby, that can just make that process a little easier for some people, a little bit less intimidating for some people. The feedback that we get from the therapists within the team is that they've noticed that engagement often improves when practical barriers are removed. So clients are less likely to cancel sessions. This is what we were talking about just now, because it's just easier to fit therapy into their day. And since counselors will offer different formats, whether that's video or phone or even instant chat in some cases. Clients can choose what feels more comfortable and safe for them. And all of that just adds up to a truly client centered approach where people feel empowered to shape their experience in a way that works best for them.
Mm. Okay, yes, again, very interesting, Ian. And yeah, so we've talked a lot about the many positives, but I suppose it's also important just to note and recognize that online therapy does come with some challenges, does it
Yeah.
not?
Yeah.
And so maybe would you mind just outlining some of the main disadvantages and share how therapists support clients to address these issues?
Yeah, absolutely. And it's really important to be open about the strength and the limitations of online therapy. And one challenge that some people will express is what we might just see as the technical challenge. Not everyone has a perfect internet connection, and sometimes there can be interruptions during a session. And we work hard to minimize those things by using secure and reliable platforms and by having clear plans in place with clients so that if there is some sort of tech hiccup, we both know how to reconnect or to continue when things are sorted out. For those people that may not be tech savvy, then if you're working with the right counselor, if you're working with the right therapist, they'll be experienced in terms of helping people through managing the practicalities of getting online in the first place as well. I think another concern is sometimes surrounding privacy, especially if someone lives with family members or has housemates. It can feel hard to find a confidential space to talk sometimes. And again, counselor or working with the right counselor or the right therapist, they'll always check in with clients at the start. They may, right at the beginning, even before therapy starts, offer practical tips in terms of how to best support clients to think creatively. And often people may they may use headphones. They may sit in a car. They may even go for a walk in the countryside whilst on a phone session, if that feels safe and private for them. And good counselors will really want clients to feel as secure as possible. And there are various different ways in which that can be facilitated. So I think it's just about having those conversations right at the beginning about those concerns and then just exploring what might be possible. And it's true also that not everyone finds online therapy as comfortable as meeting face to face. Some people feel there's a slightly different energy when not in the same room. And again, I think working with the right counselor, an experienced counselor or therapist, they will be trained to help bridge that gap, just spending extra time at the start of the sessions, for example, just helping people to just settle in into grounds before they start the session, regularly checking in about how they're experiencing the connection. The really important thing is if online doesn't feel right, a good therapist will talk really openly about other options as well. But our experience is that in the vast majority of cases, as I say, about 85% of people that come to us will opt for that way of working nowadays. When someone starts working online, they very quickly settle into the rhythm of working in that way.
Yes, I just want to share another advantage is sometimes I've started to work with people on a face-to-face value and they've moved. And because they've started the relationship with me, they want to carry it on. And because they've met me in person, they often feel there is a sort of connection, which then carries on online. So
Yeah.
there's been quite a few people who have had that. So it just offers such a wide range of
Yeah,
flexibility.
that hybrid way of working is really good,
Yeah.
isn't it? That
Mm.
first session, or maybe the first couple of sessions, they'll meet the counsellor or therapist, and then once they've got that established relationship,
Mhm.
they'll just go into that online way of
Yeah.
work.
Yeah. Yeah. Okay, great. Yeah, great examples there. And I'm just wondering for listeners are thinking if online therapy is a good fit for them, how can therapists help them to decide what's best for them? What should someone expect if they're considering getting started?
Yeah, really great question. And it's something we try to make as straightforward and as supportive as possible. So, if I talk about hope and what we offer every client before they even start working a free 15-minute consultation. And we go through the best way to work with a counselor. We'll talk about face-to-face options, we'll talk about telephone options, we'll talk about online options. We have a very open conversation. There's no commitment to have that consultation, but we just talk through what might be right for that individual client that we're working with. And during that chat, we just, as I say, talk very openly about the situation. We talk about any practical concerns that clients may have. We might talk about things like privacy. We might talk about comfort with the technology that they're going to be using, or whether people would prefer face-to-face meetings. So there's a very open conversation. And that type of pre-consultation is just a it's just a space for people to decide if that way of working is right for that individual client who wants to work on that particular thing. And of course, if together it seems another approach might be better, like in person, or a different style of support altogether, then we might go about recommending other options as well. The focus is on very open and honest collaboration and just helping clients to find what feels best for them. And I think the important thing to say is that online or face to face should always be a choice that the client can make for themselves. So it's never about placing pressure on people. It's just about opening up a discussion around the different possibilities.
Mm. Okay, yeah, that's fine. That's really clear. Thank you for that, Ian. So I'm just wondering if people have listened to today's podcast and feel they might benefit from taking the next step to consider therapy or counselling, what should they do next?
Yeah, a really good question, Wendy. And if people are looking for support, there are organisations like Hope Therapy and Counselling Services that are available. As I said earlier, we offer free consultations. People can find us on www.hopefulminds.co.uk. That's www.hopefulminds.co.uk. We offer a range of free resources, but we also offer free consultations as well, where we can just talk through the different options that might be best suited. And what about you, Wendy, as a very experienced CBT psychotherapist? I know you do telephone and online and face to face.
Yeah.
So maybe just tell people a little bit about yourself and your offering as well.
Yeah, so the best way to contact me is through my website, wendycastellino.com. Sometimes if you just Google my name, Wendy Castellino, then all the contact details come up as well. So I find that's the easiest thing. So people can phone me, text me, or email me, and I will respond to all those. Direct message me via social media as well. And people are very welcome to have a informal consultation with me and see whether there's a good fit as well. So very similar to what you're saying, really, Ian, the typical thing. And on my website, there's also some free resources that people are very welcome to have a look at and see whether there's anything there that they will find useful. Any final words, Ian? Any kind of final things you want to say about your subject today?
Really, just to thank you for the opportunity to talk about it and to thank everyone else for listening in. And as I say, if people want to just have an opportunity to talk about what might work best for them in a really unpressurized way, then people are very welcome to reach out to either of us, Wendy, and we can just go through the options with people.
Okay, that's great. Thank you so much, Ian, for your contribution today. And thank you, everyone, for listening today. And don't forget to subscribe, rate, and share this episode with anyone who you think could do with a little boost and turning their resolutions into reality. So thank you very much, and goodbye, everyone.
Thank you, Wendy. Bye bye.